Hello, this is Dr. Rotchford here, and I'm here to give you some information about opiate use disorders. And I'm hoping that with what we share here over a series of sessions and topics will empower you or a loved one to get the help they need. That is, to be empowered to take the steps required to address this very painful and devastating disease called opiate addiction or opiate use disorder. So, where do we start? It's pretty tough, isn't it? I don't know you. Well, you don't know me, really. And how am I to talk to you about what might help if I don't know you or your story or where you are in the process? It's kind of crazy that I'm sitting here trying to help you out. But I do believe, I really do, that by sharing some principles of what I've learned by helping others with opiate use disorders and my experience of helping people with chronic pain, that you'll glean and learn some things that really will help you or a loved one get the help they need. So, where do we start? Well, like I said, that's tough because I don't know. But I think getting back to the basics or some principles will always be of some help. As a physician, what's my job? My job is to promote health. That is, help people feel and act and behave best, meet their potential, and live longer. I mean, simple as that, right? Meet your potential and live a long and healthy life. I do what I can. What can I say? So, it's the same here. I mean, you come to see a doctor, you got some concerns and problems. What might I do to improve my health? Well, with this disease, the main organ involved is, believe it or not, it's not your stomach or your heart or even your skin. It's your brain. No, your brain's a very important organ. And addiction affects your brain. In fact, it involves the areas of the brain that are involved in learning and basically intelligence. If we couldn't learn and remember, well, where would we be in the evolutionary scheme of things? So really, addiction is really about what it is to be human and what can go wrong in that process of learning and remembering. Simple as that, I guess. So if my job is to help brains work better, let's talk about that. What are some of the problems in that regard? Well, let me use the analogy of glasses. Okay, we use glasses to help our brains work better, to see better, right? More clearly, help the input get in so it can be processed and effectively used. That's common sense. Nothing wrong with a pair of glasses. In fact, well, there used to be problems, right? It used to be shameful to have to wear a pair of glasses. What's the matter with you? 4 eyes or all those kind of shaming things. But obviously with information and understanding, a lot of that shame has gone away with taking steps to help brains work better, i.e. pair of glasses. Nothing wrong with it. We all will do it. Often it takes us getting older to recognize the value, but hey, we all can benefit from help with our brains, help for our brains. What can I say? So there's no end to it. So I'm here to help your brains work better. Yes, I can do what I can with medicines and other interventions to help your brain work better. But I like this metaphor or analogy of glasses because even I, as a doctor, I fit you with a great pair of glasses. You still have to figure out what's important to read and how to read and when to read and all that good stuff. In fact, a pair of glasses by themselves do relatively little if someone doesn't take advantage of being able to see clear. It's the same thing with medicines that we use in opiate addiction. They'll help the brain work better. It helps the person process and respond more appropriately to all kinds of cues and issues in their life. But nonetheless, they still have to learn new ways to respond to those issues. And that's the behavioral component of addiction care. So there I'm introducing you to a very solid principle. Let's get out of the either or way of thinking. Let's get into the both and way of thinking. a little bit of this, a little bit of that is much more likely to get you there than a lot of this or a lot of that. Okay, so that's a good principle. That's a take-home message. So I don't want to just give a person a pair of glasses. I want to make sure they know what to do once they've got the glasses on and it's fitted and they're seeing better and all the rest. We want health to improve. We want functioning to improve. We want the length of life to improve. That's what I, as a physician, am about in helping any patient comes in to see me. I hope that makes sense. So that's a principle. You know, let's get into helping brains work better. What works, what doesn't work. Indeed, that's why I'm here. I'm trying to empower you and inform you with information that will help you get the help you need. This is an area of medicine very complex. Don't try to figure it out on your own. Please get some help. In fact, I'll get into that further as we talk about dilemmas that oftentimes come up in the care of people with addictive disorders. So we talk about behavioral support for people with addictive disorders. I mean, medication-assisted treatment, that's pretty clear. Some people are confused. What does it mean to get behavioral help? Well, I can only give examples. You know, a common issue, a behavior that comes up with addictive disorders is what I call the blame and shame game. We start to behave that the answers are in blaming or shaming ourselves or others. How could they do that? Or why did I do that? That was stupid. Am I crazy? Am I an idiot? No. Or the system, oh my gosh, why would they do that? Why would they create a law like that? Why do they put all those people in jail and prison? And oh my gosh, this is nuts. Okay, quiet. Yes, it's crazy out there, folks. There's a lot of stuff with regard to this illness and its management that, from my perspective, is a little crazy. Yeah. And I don't see it changing anytime soon. So we got to get back to what does work, get into the solutions. Now, if blaming and shaming worked, hey, I'm all for it. I'm a pragmatic guy. It doesn't work, so let's stop it. But my experience is you can't stop it on your own. It really helps to have others helping you, show you how to behave in a way that you stop blaming and shaming. So that's an example of behavioral support. Ways of thinking, ways of talking, ways of responding that don't involve the blame and shame game. So I think that's an important behavioral tool. Goes way beyond addressing addictions. I mean, I'm hoping it would help you in all areas of your life if you stop that process. Now, let me be clear. We all need to vent. I do. You know, we're frustrated, something's a little crazy out there. The medical system now, it's bonkers in many ways. Hey, I got to vent sometimes to friends and families and go, oh, this is nuts. Yeah, it helps me feel better. But let's get into solutions. So that's what I'm here for. Help you or your loved one get into solutions. Find the answers that are more likely to help get you where you want to be. Yeah. That's the name of the game. And I hope as a result of my sharing over the next little while, the different topics, I don't know how many topics I'll come up with, but I suspect there's numerous for us to share. You'll see that I get it. I want you to get it as well. And I want us to get that we get it. And in that getting it, we can help others get it. And we really can do some good, not only for ourselves and loved ones, but hopefully for our entire communities. So that's the good news. There's a lot of things we can do, a lot of solutions out there, and I'm hoping to help you get into those. All right, till next time.